A major reason driving this crisis is the record number of elderly people in America, a huge generation of geriatrics with ever increasing medical needs. At the same time, older healthcare workers are choosing to retire.
Healthcare has been experiencing a shortage of nurses and other healthcare workers for long before the pandemic. And we just expect that to intensify as baby boomers continue to age and as they continue to leave the workforce.
That's due to high burnout rates beginning before 2020. Then the pandemic made it even worse. Nearly 20% left their job in the last 2 years.
The healthcare systems have been overrun, especially the emergency rooms and the ICUs, where you're taking care of people who are very sick from this pandemic, and then also being asked to take care of additional patients or work additional hours. It's a lot of additional emotional burden for us to carry.
The shortages run the gamut: lab technicians, aides, respiratory therapists, you name it. Experts tell lawmakers the U.S. needs 200,000 nurses per year to meet the increased need. And we face a shortage of up to 124,000 doctors by 2034.
Those numbers are scary because as you and I are all getting old, we will need care. And that care may not be there.
In one effort to get more doctors, medical schools are accepting more applicants. That's only part of the solution, however, as there's also a need to increase the number of physician residency positions. Residency is the period of required training after medical school, but before doctors get their medical license and can practice on their own. Resident physicians generally train at teaching hospitals like Sentara Norfolk General for anywhere from 3 to 7 years, depending on their chosen field of medicine. The federal government covers those costs for the most part at a price tag of about $1 million per resident. That allocation, though, has remained largely frozen since 1997, definitely not keeping up with the increased need.
For a while there was we built medical schools without increasing the residency training capacity, and there was a bottleneck.
That traffic jam could open up if Congress passes legislation to pay for another 14,000 residency positions. Some would be specifically for rural areas because after residency, doctors often stay put.
Roughly 20-25% of America lives in rural America, but only 10% of the physicians are in rural America.
Other new incentives may also help alleviate this shortage.
Often, if you're in an underserved area, there's lots of loan forgiveness programs, both through governments and states, but also through hospital systems.
Telehealth, one silver lining from the pandemic, allows fewer workers to see more patients. When it comes to nurses, one issue we found is that thousands of qualified nursing school applicants are being turned away. The blame is on enrollment caps, not enough full-time faculty, and a lack of clinical sites. To fix this and get more nurses into the field, some states are raising those caps, allowing part-time faculty to fill the gaps, and letting nursing students substitute clinical training with simulation hours.
Yeah, generally, I think all of the changes that I've seen are things that are important changes.
Meanwhile, hospitals do what they can to keep the nurses they have.
The 5% market increase and the benefits enhancements that we've just announced in the last few weeks are meant to ensure that we recognize our team members' contributions and that we remain competitive in the markets that we serve.
So while America invents new ways to attract and retain healthcare workers, young people who are wondering what they'll do when they grow up, and adults who might be looking to change careers may find healthcare appealing. Lorie Johnson, CBN News.